I'd like to show you today about how to take care of stitches on the hand and the wound care for stitches. The problem is that this area has bled a fair amount and will bleed after the local anesthetic wears off. You may be able to visualize this white area here. The local's still present. Over here it's a little bit pinker, but she's not really numb there. However, the point is that as soon as the local begins to wear off in this area will begin to bleed. To prevent that, I've put stitches 3, which are called pucker or bolster stitches, which cause this wound edge to pucker up or stick up. These stitches become irritable after a while, so sometime in a week these stitches need to be removed. The stitches that are across the top here, which have been placed at various spaces to help control bleeding, they will probably come out in about 2 weeks. The next part of the problem is that when she goes home, she needs to put an ice pack on this area. This area will be bandaged, but a baggie of ice, in other words a baggie like you use to put your sandwiches in, or a rubber glove like I have on my hand, a cup of ice and 2 tablespoons of salt mixed into it will make a super freezing mixture. This is placed over the dressing. The dressing will be across here, and you put the baggie or a glove of ice on and hold it on for about 10 to 15 minutes to make sure the area stays cold. That helps to cause little tiny blood vessels in the skin to clamp down. It helps prevent bleeding. This is very, very important because any bleeding that you get out through here gives you a stiff hand. It can give rise to infection. It also makes a person have to get the stitches out sometimes early, which causes not to get a good cosmetic result. There have been other procedures done on this hand in the past. The bleeding's been controlled and you really don't see many scars. That's because the bleeding had been controlled, so it's important for you to control your bleeding. Going home and working, doing things with your hand is a mistake. You'll bleed. Plus you don't have time to put the ice on. For the next 48 hours, no heavy work. You can do mild things as long as it's not having to be repeated over and over again. There's some standard things like taking the dressing off in 24 hours. If you have problems, to call. If the areas get red, sore, tender, to call. If you seem to have any problem at all, to call. At the same time, after you do take the dressing off, just a thin coat of Vaseline on here. In the past, Neosporin's been used. 1 out of 20 Americans are allergic to Neosporin. Polysporin's been used. 1 out of 300 Americans are allergic to polysporin. We just use Vaseline. If you're in a filthy situation, then Dakin's solution, which has been described on various websites and also on the wound care sheet that's given to you, can be used. And sometimes we go ahead and tell you to use the Dakin's. Soap's not good. Use foamy shaving cream to wash your hands with. That helps. Thank you a lot.